Dr. Jane Wigginton is really an esteemed doctor at UT Southwestern. She's in the emergency room service. And if you think about it, it's the emergency room docs that really know how to take care of everything because they face everything where all systems break down. She's one of the most compassionate, deep level thinkers. She's also been involved heavily in clinical trials at UT Southwestern, knowing how to lead them, as well as being human subjects. So whenever I have an important medical question, I always go to Dr. Jane. And she's part of our BrainHealth collaboration, and her expertise has helped guide us in really important ways. So I want her to spend just, about 10 minutes telling us some things. And I loved what she said. She said, our head is in the lion's mouth every day here at Parkland and some of the hospitals, and we've been able to stay safe. So I want you to hear from Dr. Jane Wigginton. So I'm going to turn it over to Jane now. Jane, tell us some of what you've learned about COVID. And I know some of the interesting things you said is how it's changed from, February, March to now even.
Absolutely. Thank you so much, Sandy. It's just such a privilege to be here and talk to you all about this because this is a very interesting topic and I'd like to share it with you from the firsthand perspective that I have about this. When we first started hearing about the COVID-19 cases, we had colleagues on the West Coast and on the East Coast, and they were telling us things about this disease. And as somebody who's been in the Parkland ER for well over 20 years, I thought, yeah, I've seen it all. I've seen just about everything, and nothing really surprises me much anymore, and nothing really shakes me or anything like that. And so we listened to the stories of our colleagues, but until that day when I walked into the critical care area to work, I really didn't understand what this disease was about. Now, the Parkland ER is about the size of a football field. And because it's so big, it's divided into a bunch of different pods. And on this particular day, I was working in the critical care and trauma pod. And so one of the first patients I had during that shift was this male who was generally pretty healthy, and he was being rushed back from triage. He had walked into triage, and the nurse was flying around the corner with that wheelchair. And she said, "Oh my gosh, this man's oxygen saturation is 65% on room air, and I put him on a nasal cannula to give him supplemental air, and it's still not going up." Well, there are very few disease processes where someone can walk into the ER and have an oxygen saturation of 65% and be sitting there talking to you. And my first thought about this was the monitor that's giving us that reading, there's something wrong with it. So I walked over and I adjusted it and I looked at it, and it was actually a good waveform, which generally means it's picking up accurate information. And so we got him on the bed, we put him on oxygen, and during this whole time, even though his saturations were about 65, 68%, he was talking to me. And that is just very, very strange, because normally a patient with an oxygen saturation of 65 to 68% is either unconscious or not breathing well. There are just a couple of congenital abnormalities with patients in third world countries where they may actually live with an oxygenation that's fairly low. So we put this gentleman on supplemental oxygen, really high flow, and we were able to get his saturations up in the 80s and low 90s, and he felt much more comfortable. He was on his phone and he was talking to his family and to his relatives. It really was disconcerting to see him with that oxygen level in his body, and to be able to talk and to function and things. When we got his chest x-ray back, his chest x-ray showed fluffy white patches all over both sides of his lungs. These are actually called ground monic for a bad COVID case. As we got more and more labs in on him, his numbers looked concerning. And so after we took care of the man and got him to the ICU, that night I went home and I thought, this is absolutely not the flu. This is not like anything else that I've ever seen in my whole career. And is it possible for us to keep ourselves safe from this sort of thing? Because after seeing someone who has this disease, I know that I don't want this. And the good news, I'm going to cut to the punchline, is yes, we can keep ourselves safe. Um, One of the important things to remember when we think about this coronavirus or this COVID-19 is that this disease is considered novel because no one has ever seen this before. But I consider it novel because it's like nothing that we've ever seen medically before. It doesn't act like anything that we've ever taken care of, or that we've ever been exposed to. You know, in the flu, it's normally the very young and the very old who have problems with this. And while children, for the most part, don't seem to be very affected by COVID-19, older people are, people with comorbidities, and people who seem to be overweight. But one of the interesting things about this novel coronavirus is that it also has a little bit of randomness to it, or at least it looks random to us today. I think in the end, we're going to find out that there are some genetic links to those who do most poorly in this. For example, there was a study that was just recently released from Italy that said that identical twins seem to have the same course in the disease compared with non-identical twins, which kind of ties in a little bit, or is suggestive of that genetic component for this. Another thing that's kind of novel about this disease is that SARS and MERS, which we have seen before in the past, of course, generally only attack one lung. Well, this COVID-19 attacks both lungs. And that's why these people are getting so hypoxic, because the white fluffy places that I told you about on the x-ray of the lung is actually fluid where there should be air. And so that's a big deal to have both lungs down or taken out at the same time. And that's why these people can't oxygenate very well. Another thing that's very novel about this is that in illnesses like the flu, most people who live do well and they get better and they go on about their business. But this novel coronavirus is different in that respect for some people. Some even young people, when they go home from the hospital after having a bad respiratory case of it, they have to take oxygen with them. They're not able to still breathe normally. And we don't know if that's going to convert into permanent fibrosis, or if they're going to have heart problems or clot problems or strokes or things like that in the future. And so this is another reason why we really want to try not to get this. The amount of hypoxia in these patients is really unprecedented for just about any disease process. So for all of these reasons, this is something very different. And one of the reasons that you really want to put off getting the disease as long as possible. When this disease first came to the United States and doctors started treating it, as I said, I was shocked when I walked in and saw that gentleman sitting there talking to me with an oxygen saturation of 65%. And in our medical training, anyone who has an oxygen saturation that has a real number of 65% and is sick, probably, in the past has needed to be intubated. And so you can't fault these doctors who intubated these people for intubating them, because that's what we generally do with that sort of thing. But in this patient population, what we found is that intubating these people actually may bring more fluid into the lungs and may cause them to have a worse course than if we had just prone them or laid them on their stomach or laid them side to side. So this is a very important thing that we've learned over the past couple of months that really changes the course of people who have very severe disease. So this is a very important reason that you want to kick having this down the road if you get it at all. Now, I'm not saying that everybody's going to get it, and I'm not saying that that we can't protect ourselves, but you still want to protect yourself as much as possible. I've heard people talk about having COVID parties and things like that and saying, oh, well, we're all just going to get it. We might as well get it over with. And that is absolutely not the attitude that any young person or older person should be taking about this thing, because it is serious. I think that the other thing that we have to think about putting this disease off for a period of time is that I believe that we will have a vaccine in the foreseeable future. It's very interesting. Brett Gerard, who is the Assistant Secretary for Health and Human Services, used to be faculty at UT Southwestern. He's been the head of DARPA. He has been at Texas A&M University, and he is now one of the people who's heading all of the work that's being done on COVID for the government. Interestingly, when he was at A&M, one of the things that he specialized in was creating pods where vaccine could be mass produced quickly and mobily for just such a situation as this. And so it's very reassuring to have him in this role right now. It's almost miraculous that he's there in this role. And so I have great confidence that hopefully in the near future, some of these vaccines that they're testing will be out there. And we need to do everything that we can to protect ourselves so that we can hold out until there's a vaccine. The other thing that we have to think about trying to keep ourselves safe for as long as possible is that as the time has gone on, we know more and more about different treatments, the remdesivir, the hydroxychloroquine, things like that. We're learning what may work and what doesn't work. And you really don't want to be on the front end of a novel disease like this, because we don't know best how to treat somebody at the front end. It's going to take information, and it's going to take time, and it's going to take clinical trials. And right now, we just haven't had that much experience with it to be able to know anything that's definitive. And so while we're trying these different drugs and different therapies and proning people and not intubating them now, these are things that have evolved over time and will continue to evolve. I know it's been very frustrating for the public, because one day the CDC or the Surgeon General will say one thing, and then they'll come around in another week or so and say, oh, well, initially it was don't wear a mask, now it's wear a mask. It's not that they weren't telling it like it was at the moment, but things have changed and considerations have changed and information has changed. And so this is just a very rapidly evolving system. Another very important thing that we need to remember about this, and one of the things that I think is one of the most interesting things about this disease, interesting not necessarily in a good way, but is that in the flu, people really aren't contagious until they actually have symptoms. But with COVID-19, there have been some studies that have shown that people maximally shed virus up to 17 hours before they have their first symptom. Very important point, because we talk about taking people's temperature. We talk about people staying at home if they feel ill. We look at people and they look well and they feel well and they look healthy. But one of the things that you have to do to protect yourself is just assume everybody that you come in contact, whether they have symptoms or not, may be shedding the virus. And you need to use that information to protect yourself. That's a really big deal. In the hospital, sometimes they try to sort different patients as to those having respiratory symptoms and those having non-respiratory symptoms. But when I'm working in the ER, I just assume that every patient that I come into contact with may be shedding the virus. And so I use pretty much the same precautions for all patients that I take care of there in order to protect myself. I think the last most important point is, though, after I went home, taking care of that very first COVID patient who was really sick, I was shaken and I was a little scared. And I wondered if we would be able to protect ourselves and we would be able to keep from everyone getting this disease. And what I found is that by changing habits and changing practices and being careful all the time, that we have been able to do that. As Sandi said at the very beginning, I feel like I stick my head in the lion's mouth all the time because I am intubating some patients who may have COVID. I'm looking in the throats of people who may have COVID because they may have a sore throat. And I have my face in their face quite a bit, but I've been able to keep myself safe. And my colleagues, both the residents and the faculty, to my knowledge, have all kept themselves safe by using some of these tools that I'm going to talk to you about next, and give you an idea of how it is that we're able to do this day in and day out and not get sick. One of the things that I want to emphasize is that these have to become new habits. And I think that these new habits will spill over very well into other parts of our life. For example, we may be able to stave off more flu cases. This disease is much more contagious than the flu is. The R naught of the flu, I don't know if you've seen that referenced in media, which is an R0. It's actually called the R naught. The R naught is how many people get the disease from someone who's infected. The R naught of the flu is 1. So it's assumed that every one patient with the flu infects about one other person. When the coronavirus came to the United States, when COVID-19 came, the R naught was anticipated to be 3.5 to 4.5. So each one infected person would infect between 3 and 4 different people, and that's when you have exponential growth. What's interesting about the R naught for these diseases is that it can be changed and it can be controlled. And by the physical distancing and the care that's been given, the R naught right now has been around 1 or less than 1. So we've changed it dramatically. And that is going to have to continue to be a habit because we don't know if there's any seasonality to this disease. You know, the flu kind of goes away in the summer, comes back in the winter. We don't have enough experience with this disease yet to say that that's the case. And so it's very important for us not to let our guard down, but to make these habits stick. One of the books that I really, really love is a book by James Clear. It's called Atomic Habits. It came out in October of 2018. And he has 4 main points about making habits stick. And the first habit is, or the first way to create a good habit is to make it obvious. So one of the things that I do is, for example, with my hand sanitizer, my kids laugh at me, but I put hand sanitizer all over the house. I keep it in my car, I keep it in my pocket, and I keep it in my purse. Because if you have to go and hunt for hand sanitizer, you're not going to use it very often. And so making it obvious, making it something that's kind of in your face all the time will help you to use it. And hand sanitizer is a huge part of preventing the virus from spreading to yourself and to others. Another thing that's really important about making a habit is to make it attractive, or as attractive as you can. This hand sanitizer is actually not the Purell that was in here. This is hand sanitizer that my daughter and I made. You can make hand sanitizer with anything with 60% alcohol in it and it will work. We put essential oils in there and made it smell really good the way we wanted it to. And so now there's some pleasantness to using hand sanitizer because it has a really nice lemongrass smell, and it's a good thing. The third thing about making a habit stick is to make it easy. And that's another part of putting it out all over where you're going to be using it. It's the same thing with masks. I don't put my mask up all the time. I put them in a brown paper bag. This is what we do at the hospital too. I put my mask in a brown paper bag, and I have more than one, and I leave one in the car in case I forget mine. I have one in my purse, and I just keep masks with me in little brown paper bags just to make it easy to use them and to make sure that I don't forget them and I don't have a lapse in my new good habits. And the last thing is to make it satisfying, and it should be very satisfying to keep yourself and your family safe. So the things that are most important, I think, to keeping yourself safe, and when I say keep yourself safe, I mean that in the deepest sense, because what I learned from working in the ER is that Parkland can't keep me safe. UT Southwestern can't keep me safe. The gym that I go to can't keep me safe. It's all up to me to keep me safe. They may give me tools to help me stay safe, but that vigilance and those habits being formed and reinforced and reinforced and reinforced are really on me to take care of. And what are those habits that are going to help keep us safe? Well, one of the most important habits is hand washing. So in order to hand wash correctly, you need to use soap and you need to use water, and you need to wash for 20 seconds, which is a long time. It's happy birthday twice if you sing it to yourself. One of the places that people really miss on their hand washing are they miss in between their fingers and they miss this part of their palms. And so if you're going to use hand washing as one of your means, which you should, to keep yourself safe and keep others safe, then you need to make sure and concentrate on all those areas. It's really important. And some people prefer to wear gloves instead of hand washing. I'm not a big fan of gloves. Gloves are very important if you're dealing with something dirty or if you're dealing with a patient. But just from day-to-day activities of daily living, for example, if you're going to the grocery store or something like that, I think that people actually do things differently if they have on gloves than if they don't. There have been some studies recently that have been done when PPE was very scarce. They had always said, don't put hand sanitizer on gloves because it may harm the integrity of them. But that's been found not to be the case. And so if you are going to wear gloves, number one, use hand sanitizer with them. And number two, put them on and off correctly. So use hand sanitizer first, put them on, and when you go to take them off, don't pull them like this, but if your hand is clean, peel up and pull it off like this. And if this hand's clean, put it up under the palm and then take it off. Roll it up and take it off and throw it away, and then sanitize your hands again. The same important thing with a mask. If you're going to put a mask on, depending on what type of mask, don't ever touch, well, first sanitize your hands, and then don't ever touch the part of the mask that's going to go onto your face. So for example, this is a procedure mask. And when we put this procedure mask on, you just pinch your nose and it gives you good coverage. And then when you take it off, you don't touch the inside. Eye protection is also important. You can use sunglasses for eye protection. I use goggles like this when I'm in the ER. They may look a little goofy, but they're also helpful. There are many different types of masks. I'm going to talk about some other ones in a minute when we get on to travel and things like that. The last thing is, of course, physical distancing and wiping surfaces. So I'm a fanatic about wiping surfaces, and it's very important to know what type of cleaner that you're using, because different cleaners take different amounts of time in order to actually work. So some bleach-based products may take 10 minutes to be effective. You need to know what sanitizer you're using when you use these things. There are some viral wipes, there are some called Viracept that are actually fully active in 1 minute. So you just need to know what it is that you're working with and use it appropriately. So I have gone from 180 degrees from being very concerned and very afraid of this disease to having great respect for it, but knowing that I can protect myself, or feeling that I can protect myself by using these new habits that I have. I reinforce them every day. I try not to slip up. I have integrated them into my daily lifestyle, and that's what I would recommend for you to do as well. Right now, I'd like to move into some of the questions that we had that were asked. They were great questions. Thank you all for submitting them. The first question is, what do I do if I've been around someone recently who's been diagnosed with COVID-19? And the answer to that question really depends on how much contact you had with that person. If you were just in a grocery store and you casually bumped into someone who may have had COVID-19, and I don't mean bump into physically, but if you were 6 feet apart, but you ran into someone who may have had COVID-19, you really don't need to do anything. If someone sneezes directly on you or coughs directly onto you, you may need to think about it. But most of the time, people who come into contact with someone with known COVID-19, they need to self-quarantine. And they need to self-quarantine for 14 days is the recommendation right now, which involves staying home, limiting your interactions with other people, even if you don't feel ill. Because a lot of people will have the virus and will shed the virus and won't have symptoms. So it's very important to self-quarantine. The next question is, what should I do if I think I have symptoms? It's really important, again, to self-quarantine. These symptoms can be very variable. Some people may get a sore throat. Some people have a dry cough. Some people have some shortness of breath. Some people have some nausea and vomiting. And if you think you have those symptoms, it's important to call your healthcare provider and they can direct you where to go and get testing if you would like to be tested. Otherwise, if you don't want to be tested, then you need to stay home and self-quarantine. If you've had no fever after 72 hours, and if you have symptoms that have greatly improved, and if it's been 10 days since your first symptom, if you had symptoms at all, then you should be okay to go about your business. Another question was, should I get the test done just to see if I've had it? That's a very interesting and a very difficult question. Some tests that came out early in the market didn't really identify COVID-19. They only identified coronavirus. So if you are going to get tested, particularly an antibody test, you need to make sure that you get a test that's specific for COVID-19, not just coronavirus, because coronavirus includes the common cold. And most of us at some point in our life have had the common cold, and we don't care about that. We care about specifically COVID-19. One reason you might want to get a COVID-19 test is if you think that you've had it and you might want to donate plasma to those who may be sick with it. And so that would be one instance where it might be useful. Otherwise, one of the problems that we have right now with testing people for antibodies is we don't really know what the antibodies mean. We don't know at this time point if people can get the disease more than once or if they're just having relapses of it. And so I would probably at this point, unless you have a specific reason to want to know, I would probably not recommend getting tested for antibodies. I have not done it myself. My family hasn't done it. If I thought I had it and wanted to donate convalescent plasma, then I would do it. But I think it's just as good to wait until we really know what those antibodies mean in the blood. Another question is, what are your thoughts on herd immunity? And is herd immunity still possible? Herd immunity is generally thought of as something where the society has had 60 to 70 to 80% of the people in its population who've had the disease. And so even if someone gets it, it won't spread like wildfire. This is kind of a difficult situation. Remember, this is the novel coronavirus, because we don't know that if people get it once, that they can't necessarily get it again. And so herd immunity may or may not be something that's down the road for us, but we don't know enough about it right now. And I hate to hedge on that, but there are just so many unknowns about it that no one can really comment on that. A question about flights. how best to prepare for and experience a necessary airline flight. Really important if it's a short flight. I had my mother fly down here when all this started because she lived in Kentucky by herself, and I didn't want her up there with no one to be with her. I told her to take wipes for everything on the airline seat and the backdrop and everything, to take gloves to wipe with that. That's one time that the gloves are good. Think about all the surfaces that you touch in that may not just be the flat surfaces. For example, the seat adjustment, things like that. You need to wipe those as well. Take hand sanitizer, of course, and take a mask. Now, in a close place like an airplane, there's a special mask that I got from my mom. This mask is about $79, but it's reusable. It's made by a company that makes CPAP machines. I have no consideration for showing you this, but it's called the Envo mask, E-N-V-O. It takes about 3 weeks to get one of these if you order it. So what's so interesting about this mask is it's an N95 mask. It's NIOSH certified. It has an exhalation valve on it, so it is not a surgical field mask, because when you blow out, there will be a little bit of air that comes out, but when you suck in, you still have a NIOSH certified N95 mask. And these were made to put around your ears, but none of the doctors who wear them are wearing them like that. They're hooking them here. And the beautiful thing about this mask is that it has a gel seal, unlike other masks that are N95s. And so it fits comfortably against your face, and it doesn't take much pressure. This is far more comfortable than any other N95 mask that I've been able to find. And so for airline purposes, even though it may look a little goofy, for safety, and I know the airlines are working really, really hard to make everything safe, I would consider something like this. If not, I would get the best mask I can. If it were a short flight, I would try to go to the restroom ahead of time. I wouldn't eat or drink on the flight, and just take these precautions. If I live with someone who is at higher risk, what additional precautions do I need to take, if any? I think that keeping somebody safe, if you live with someone higher risk, is just making these habits and following them meticulously. When do you think this will be more under control, or is it now? I don't think that this is really under control right now. I've seen a number of pretty sick coronavirus patients in the ER recently. And so I don't think it's under control at this point, but I do think that we have decreased the spread by social distancing. Another really important question is that now that restaurants and other venues are open, what's your general recommendation about going to those places? I think it's important to check the business's practices in advance, make sure that their employees are wearing masks, and make sure that their employees are wearing the masks correctly. One of the things that drives me crazy is when I go into a place of business and they require masks and the people are wearing the masks like this. Well, that doesn't do any good, because they're still breathing virus if they're infected out their nose. So when you go to a restaurant, make sure that people are wearing their masks correctly, and check on their website about surface disinfecting, about distancing that they have between tables and between people, about ventilation, maybe even dine outside on a patio if it's not too hot, and check and see how their menus are disinfected. Does taking temperature help to figure out who's at risk? Well, as I said earlier, people seem to shed the most virus before they actually have symptoms. And so it may or may not help. If someone is febrile, then it is helpful. But just because someone is not febrile does not mean that they are not shedding virus, and we need to remember that. Another very important question is about a pulse oximeter. When we have a patient that we suspect of coronavirus, we often send them home with a pulse oximeter and have them check their oxygen levels. it's important to know that it's helpful if you have a baseline of what your normal oxygen level is before you actually get sick. There are a lot of different pulse oximeters out there, and they're reasonably accurate. Normal people have a pulse oximeter level between about 95 and 97%. That's considered normal by the American Lung Association. Anything below 95 to 97%, unless you're a big smoker or have COPD or something like that, would be a reason to call a doctor. Anything below 90%, we would recommend you go to the ER. If you use a pulse oximeter, it's also helpful to get guidance from your healthcare provider. Another question, what symptoms should indicate you should go to the hospital versus just isolate? If you become short of breath, you need to go to the hospital, because when people get short of breath, some people don't progress, but some people progress fairly rapidly. If you think you may be a little short of breath and you have a pulse oximeter, my thought is I would get up and walk across the room with the pulse oximeter on and see if your oxygen saturations decrease. Some people are able to maintain their oxygen saturations pretty well if they're sitting, but when they get up and walk with COVID, then their oxygen saturations go down. And so I think it's a good idea to try it both ways if you can get up and walk. That's the preponderance. I know we're out of time at this point. I'm so sorry for the technical difficulty that we had earlier. And I don't know if there are any other questions, but I'm happy to answer them if we have a minute.
Jane, this is hopefully will be two very quick questions from Cher Jacobs. I'll start with the most important one, and that is, how accurate are these COVID-19 tests? And secondly, kind of related to the going to the restaurants, but I'm assuming your feelings are the same about going hair salons and nail salons. What are your thoughts on that, especially if you're over the age of 65?
Yes. So I think that that for the first question, I think that wait, Gail, give me the first question again. I'm sorry.
Oh, sorry. The first question was, how accurate are the COVID-19 tests?
Are the tests? Yes. Yeah. The tests are not as accurate as we would like them to be. They're always developing more. The tests that we've been using in the hospital for patients has an accuracy rate of about 70%. So some patients who we have a high index of suspicion as to having COVID-19, we've tested up to 3 times, and who have been very sick. And the tests are just not as accurate as we would like. They're always turning out better tests, and they have become more and more accurate. We've gone from nasopharyngeal swabs to nasal swabs, and now one of the more accurate tests is actually spit in a cup, but you have to spit 5 cc's, which is quite a bit of spit to produce. But that seems to be one of the most accurate tests that we have right now, but they still deliver a lot of false negatives. And then about going to the hair salon, things like that, it's very similar to the restaurants. Just make sure that they have good practices that, particularly in a hair salon, you're going to be close to at least one person there. Make sure that they wear their mask correctly. And I don't think it's inappropriate to kindly ask them to cover their nose with their mask if they have it hung down around their chin like so many people do. I think that you have to do all of these things to protect yourself. Keep your hand sanitizer. Make your habits where they're going to stick with you, and use them. Don't let down your guard.
Jane, this has been so phenomenal. I think all of you that are on this call can tell how incredibly bright, compassionate, thorough, and I think everyone wants to have Jane for their doctor, Dr. Jane. She has helped us draft a card to carry with you that we're going to be giving out. We'll send to you with the habits to form. So I love the idea that each of us, if we will teach all the people around us to be as safe as possible, and use that. And if you have other follow-up questions, I'm sure we can send them to her and send out to you all, because it is an evolving disease. And we can also plan another incredible webinar with you, Jane. Just Thank you. Thank you. Thank you for your time today and spending
Oh,
time with the group. We really appreciate you.
oh, it was my pleasure, Sandy. I just love everything that you're doing and everything that you're involved in, and I'm just privileged to be a part of it.
Thank you. You're tremendous. Thank you, guys. Thank all of you for coming on. Bye-bye.
Bye.